All right, facing periodontal disease. It can be daunting, a little scary, right? But maintaining good dental hygiene, that's the key to prevention. If you find yourself in need of expert care, turn to Troy Family Dental in Troy, Illinois.
Periodontal disease is actually called the silent killer of teeth because there are really no symptoms associated with it. Patients, they think, oh, I've got some bleeding gums, but, doesn't everybody's gums bleed? And it's like, no, healthy tissue should never bleed of any kind, but there's no pain. A lot of times patients won't come in for 10 or 15 years, and the reason they come in is because their teeth are getting loose and they're wondering what's going on. And by that time, it may be too late. All the bone is gone.
The reason doctors refer to this as the silent killer of teeth is because the symptoms of periodontal disease are very subtle.
There is no pain, there is no discomfort. It's actually the gum tissue gets puffy, turns from a pink color to a reddish purplish color, and the gums tend to bleed. But not everyone bleeds all that much.
That's Dr. Richard Boatman of Troy Family Dental in Troy, Illinois. He says the most important way to prevent periodontal disease and just your overall health is to keep up with your routine dental checkups.
When we have a patient that has periodontal disease, we need to know what the underlying damage is. So in a healthy situation, if we can actually take that patient and peel back their gums, in a healthy patient, we're going to see nice, healthy bone. It's nice and tall around the teeth, and the teeth do not move whatsoever. If we get some bad bacteria and we don't know that it's there, it's slowly doing damage as time goes by. And what can happen is, if we peel back the gum tissue or somebody that has periodontal disease, we can see the bone damage that has happened. They produce toxins that makes that bone slowly recede away. The patient doesn't know what's going on. Their teeth start becoming loose. If it gets too bad, then we can't save the teeth, and then we have to go into something like a denture or implants.
At that point, Dr. Boatman says they can't get the bone to grow back, which is why if you don't already have routine dental checks on your calendar, you should set them up now.
When a patient comes in for the very first time, we're going to take a full set of x-rays to look at all of the teeth individually. We'll probably do a CT scan, especially if they have missing teeth or they might be a candidate for implants. When they come in for their checkups, typically we only take that full set of x-rays once every 3 years. The first 6 months we'll take bite wings of the posterior, the back teeth. The next 6 months we'll take bite wings of the front teeth, so we can look between the teeth and see, are there any small cavities starting that we need to get to so they don't continue to grow.
Speaking of cavities, Troy Family Dental does have a way to prevent you from getting cavities in the first place.
Sealants are one of the best preventative measures that we've had in dentistry for many years. A sealant is a resin material that once we dry and prepare that enamel, we can flow it into those grooves, cure it with a light, and it's completely sealed out, and things cannot get in there.
After spending quite some time with Dr. Boatman, it became clear to me the only way to keep your body healthy is with a simple visit to Troy Family Dental every 6 months.
The mouth is really the gateway to the body, and it affects our overall health completely. It aggravates diabetes and all kinds of other systemic diseases, heart disease. It's so important. It's critical. People have routine dental checkups.
Troy Family Dental is located in Troy, Illinois, and that's about 20 minutes from any bridge. You can give them a call in Illinois at 618-477-8421 or visit troyfamilydental.com for more information.
And they're just really nice guys there. Kent, thank you.